day everyone, my name is Dr. Wesley Reyes. I'm a surgeon. I do general surgery. I also have a special interest for diseases of the colon, rectum, and anus. I'm here to talk about colorectal cancer. So cancer in general is an abnormal growth of cells that tend to invade other organs. So these are cells or tumors that grow sa colon and or sa rectum. They grow big and then they try to invade not just the colon itself, but they can also spread to other organs, no? Through the bloodstream or yung tinatawag na lymphatics. And that's how they will cause their symptoms. Symptoms of patients can vary. There are actually patients who have no symptoms yet, especially if the colon and or rectal cancer are early. Symptoms can also be bleeding per rectum. They can be obstruction. When you say obstruction, usually they're going to have trouble eating. Minsan nasusukayan sila, minsan they feel bloated, minsan they feel nauseous, and sometimes they're going to have a hard time passing flatus or passing stools. Or minsan rin meron yung tinatawag na goat stool-like stool or tae ng kanding. No? Minsan ganun. Minsan rin naman, puros basa lang yung tae. Or meron bang changes sa bowel movement, sa bowel habits nila. Dati, usually, regular sila. Tapos, let's say, in the past weeks, 2 months, no? Lumilit yung stool nila. So, these are just some of those symptoms. People who are at risk for colorectal cancer are those who are, let's say, above 50 years old and those who have a family history of colon and rectal cancer. So for the risk factors, aside from the age, we mentioned also about family history, right? Other would probably be yung mga tinatawag na diet, no? Too much red meat, too much processed food. Yung genetics, well, that's another thing, yung tinatawag na genetics. Usually, if my family history, let's say mama, papa na side, and then chances are, meron rin sa offsprings, okay? Now, there are also some na wala sa mama, wala sa papa, but pagdating sa inyo, nagkaroon. So, pwede rin kasi ganun siya. Well, usually there's a consultation between patient and physician. There's going to be a discussion. And let's say the physician is suspecting of colon and rectal cancer. So, let's say, patient dumating sa akin, nakasuspetsa ako na, baka ito siya may colon ba or rectal cancer. So, first, I would refer to a gastroenterologist for yung tinatawag na colonoscopy. And then, other tests would also include yung tinatawag na CT scan. So, we can have what we will call like a radiologic map of your abdomen. No? We can see how the tumor is invading other organs, if meron bang lymph nodes, if apektado bang ibang organs like your liver, and yung nasa ibabaw like yung mga peritoneum. No? Another test, especially for rectal cancer, meron siyang additional na yung tinatawag na MRI. That's for the pelvis sa rectum. Okay? That's for yung tinatawag natin na tumor staging. Titingnan natin kung how deep the tumor went. Kung invaded ba yung other structures sa pelvis. So, yun yung tatlo, colonoscopy, CT scan, and or MRI if kasama ang rectum. And we have all those here sa Davao Doctors Hospital. Mainstay of treatment for colorectal cancer is surgery. Now, for colon cancer, usually you need to resect the tumor and then you have the option also to anastomose, no? So, yun yung first option natin. For rectal cancer, yes, it's also surgery, but oftentimes we would also include what you call a neoadjuvant therapy, which is composed of radiation and or chemotherapy prior sa surgery. Ang goal nun, yung tinatawag na neoadjuvant sa rectal is to downsize the tumor. So we would have better results after the surgery. Colorectal cancer can be prevented by doing screening colonoscopy. Okay, so what does screening mean? It just means that you do the colonoscopy while there are no symptoms yet. So that means detecting who are those who are at risk. No? So sino bang at risk sa atin? Everybody above 50 years old. Okay? Usually kasi pag, let's say, intestine, usually you will only get symptoms pag malaki na yung tumor. No? Pag malaki na siya, pwede na siya magbara. So may symptoms na kayo. pwede rin siya mag-bleed. Ibig sabihin, may symptoms na yun. No? So, pag sinabi natin screening, hanapin natin sila habang maliit pa. Kasi pag maliit pa yan sila, let's say ito yung bituka, maliit pa yung tumor, hindi pa man ito makakos ng bara. Wala pa ito siyang simptomas. Okay? So, gusto natin mahanap sila habang maliit pa yan sila. No? So, yun na, sinong at risk? Anybody above 50 years old. So, pagtapak ng 50, maganda meron kang baseline, no? Or screening colonoscopy para masilip ang bituka. Now, if merong makitang polyp, usually mag-start yan sila as polyp. Maliliit pa. Pag may makita ng polyp, usually matanggal na yan ng through colonoscopy. Now, once natanggal yan, pag biopsy, suspicious siya, at least natanggal mo na. No? So, in a way, na-prevent mo yung polyp na yun from progressing to a colon or rectal cancer. So, that's how to prevent colorectal cancer. Now, other people who are at risk, like I said before, let's say family members. No? Family members. A parent was diagnosed with colon or rectal cancer at a certain age. So, at risk ngayon yung offsprings. So, there are also, aside from those who are 50 above, yung mga offsprings na yun, they are also recommended to have a screening colonoscopy. So, hindi na antayin mag-symptoms sila. At what age? Minus 10. Let's say the parent was diagnosed at 45. So, minus 10. As early as 35, meron na silang screening colonoscopy. Or let's say na-diagnose at 60. Minus 10 is 50. Huwag na mag-wait until 50. As early as 40, pwede na mag-scope. If you have concerns about colorectal cancer, please talk to your doctor. Early detection and treatment are the best ways to improve chances of a successful outcome. Thank you.